Good evening, everyone. I'm Riley King, and welcome to my evening news report right here on the Riley King Network. Let's begin. New Hampshire reports more than 300 new COVID-19 cases in a single day for first time. Daily PCR test positivity rate at 2.6%, officials say. For the first time, New Hampshire officials announced more than 300 new COVID-19 diagnoses in a single day on Thursday. Officials announced 323 new infections, with 270 people testing positive via a PCR test and 53 cases confirmed through antigen testing. The daily PCR test positivity rate is at 2.6%. Dr. Benjamin Chan, the state epidemiologist, said the state's 14-day case rate is at 178 per 100,000, which is higher than it was last week. 4 new hospitalizations were reported, and 64 coronavirus patients are currently hospitalized. The death of 3 more people were attributed to COVID-19, bringing the state's death toll to 495. All 3 victims were associated with long-term care facility settings. Chan said the coronavirus is widespread in New Hampshire and that officials are seeing substantial community transmission in all 10 counties. New Hampshire Department of Health and Human Services Lori Shibberton, the commissioner, announced there were 3 new outbreaks at long-term care facilities in the state. The first one at Cawas County Nursing Hospital in West Stewartstown, the New Hampshire Veterans Home in Tilton, and the Prospect Woodward Home in Keene. All counties are at Phase 1 in terms of visitation to long-term care facilities, Shibberton said. Because of the rise in number of daily COVID-19 cases, the state announced Thursday that it will no longer conduct contact tracing for every single case. Instead, officials will focus on certain patients, including people under 18, people over 60, and those in congregate care settings, and healthcare workers. So we are asking people who have been diagnosed with COVID-19, and we are asking our healthcare providers and local partners to help with the outreach effort, Chan said. Additionally, the state is warning about 4 instances of possible community exposures to COVID-19 at polling places during last week's general election. People who voted in person in the state, especially at these polling locations, should monitor for symptoms and seek testing if symptoms arise. And that does it for this evening news report right here on the Riley King Network. I hope you all have a great rest of your evening, and I'll see you back here tomorrow for another news report. Good night and goodbye, everyone.